Are they speaking faster, more incoherent, less understandable? And when we look at things in these levels, this helps us to try and intervene earlier so that we don't get to that level 4 where that person is feeling like they really do need to protect themselves physically. And despite our best efforts to be proactive, sometimes that individual may respond physically or verbally in a situation. And what can we do? And some of the things that we work with staff and family members is looking at some ideas of what we can do. We want to think of things are not going to be 100% perfect 100% of the time. So if we expect that things are going to be 100% perfect 100% of the time, then we're setting ourselves and our loved one up for failure, really, because life just isn't perfect like that. But when we get to those moments, what can we do? So the first thing is, now is the time to provide your undivided attention. And now is the time to focus solely on the needs of your loved one so that they know that you're ready to support them in the moment. An important piece in the moment is validating the emotion that individual is expressing. It can be extremely frustrating for a person to not feel like they're being heard or that their emotions are being understood. So it's okay to say, I can see you're upset right now. I know that you're upset and I would like to help. We want to think of things in terms of unconditional positive regard. This is the time to be as positive and provide as positive feedback and support as possible. We want to redirect that individual in a meaningful way. Is there a way that we can redirect that person to something that is important to them? This may be taking that person out of their current environment or giving them a chance to participate in something that allows them an outlet, like something physical. And I think this one to me is always the most important one. Sometimes doing nothing is a plan. We feel at times that we feel like we need to intervene and we need to do something. And sometimes the situation calls for us just to be there and allow the opportunity for the individual to express themselves. If they are safe and not hurting themselves or others, it's okay to give them that time to express themselves. And at some point, that person, fatigue will be able to settle down. You'll be able to provide a more meaningful intervention strategy. And as I said, it really is about creating a bag of tricks. Not everything is going to work 100% of the time, but if we have a few things that we know that work with our loved one, then we can try those things and hopefully help better support them to be able to express themselves. And the last sort of slide is actually in one of the booklets that is provided at the back of the room through the University of Stirling. And it's just talking about coping with the behaviors that we might be experiencing to help better support our loved one. So it's about putting ourselves in our child's shoes and what are they telling you. Thinking ahead and planning for situations. Letting others know they will understand. Offering reassurance by touch and holding. Redirecting people to calming, soothing activities that are meaningful to them. And creating a supportive network for yourself and allowing yourself to take the breaks as you need them. And I think that is everything. There was a few of the resources, and some of this material is from a variety of different educational initiatives that are currently being done in Canada and in Ontario around supporting older adults living with dementia, and that's where we grabbed a lot of the material from. So thank you very much.
Are there any questions you'd like to ask them?
I'm going to ask a question that perhaps others have been thinking about. In theory, it all sounds good, and it sounds like it should work, but in the moment, that's a different thing. And sometimes when the child is having an abusive behavior, being kicked down the stairs doesn't sound too bad, but you can't do that. So how can the family who already has family members turning their back on them because this child has a disease find support that they need? Who else can they reach out to in the community? Because many family members, especially grandparents, are well noted for this, that they will turn their back on the parents and the child because this is a thorn or a black mark on the child. So who else can they turn to? Because dementia can change as quickly as the tide.
Well, thank you for bringing, and I wish I could say I have a complete answer for that, but I will say you've left me a little bit speechless because I can't pretend to know what this experience is like, and I will say that from the very beginning. I can't pretend to know that. Yeah, sure. Yeah, if you want to.
The one thing that we do, one of the suggestions that when we talk with people with dementia and their family members, and again, this is from the perspective of those with older adults, a lot of times the families just need to be comfortable enough to ask other people for help. Because I think that you're right, and we hear this all the time with older adults as well, people turn away from them because of what they're experiencing. But I think there is also, there's a stigma attached to dementia, and that older adults anyway know and feel. But the one thing with coming to being able to accept that a child or an older adult has dementia is to be able to, and that was one of the pieces of advice, let other people know that the child has a dementia, and this is why they are responding in this way, and that try and teach other people what the best strategies are for your child, and share those strategies with other people. And also when you say people turn away from you, yes, that's a reality, and it's a reality for older adults as well. People will turn away from them. But I think we have to also be comfortable in asking others for help and not shying away from that, because in order to be healthy, for you to provide the best care for your children, you have to be healthy. So you need a support network yourself. So you need to be able to share the diagnosis with other people, and then to be able to say, I need help.
It's kind of a question and a comment, kind of like Rhonda's, but in terms of like the baseline is they lost their verbal skills, so we don't really know if we're getting it right. We're guessing or doing our best response by watching them behavioral, but we don't know of the 5